Here we go. So let's go on to the next slide. Just going over some quick Zoom stuff, and know we all are very used to Zoom by now. Um, but just want to give you a little reminder that you closed captioning is available if you want to turn it on. If you go down into that little more button that has the three dots, and that should allow you to turn on closed captioning. Um, Also, if you have questions, I know I see that I think most of you are muted, and definitely request that you stay muted to get rid of any background noises. But also, if you have questions, feel free to put those into chat. Garen's going to keep an eye on that for me. And or if we're at a pause, feel free to unmute. Encourage y'all to speak up, to participate, and share comments with us today, as well as questions. Um, Also, if you have any technical issues, hopefully the technical issues don't keep you from using that chat box, but you can message any of us home-based folks, but ideally Garen, because Garen will be keeping an eye on the chat. And I may not be because I'm going to be presenting a lot. Um, but we'll be keeping an eye on that chat and pausing periodically to answer questions. You probably already saw that we are recording the training today. We will be recording the training. We won't be recording. There's going to be a discussion time, breakout rooms at towards the end, and we won't be recording that. And we will send out slides and some resources and materials after the training, and want you to stay a little bit once we're done with our presentation today to answer our post-training survey. Okay, so wondering if any of our HSA colleagues here today want to introduce yourselves, give some announcements, and while you're doing that, I want to encourage everyone to say hello in chat and put in your name, your pronouns, the agency you work for, and what your role and title with that agency is.
Sure. Hi, everyone. This is Kalia Parrish speaking with HSA. My role includes overseeing the trainings that we partner with Homebase to provide for you all. And I'm joined by my colleague Leslie, who also supports with that. Um, just wanted to start off by saying thank you all so much for taking time out of your day and the difficult work that you do in the communities to support people experiencing homelessness. I know you all are busy and appreciate your making time for this training. We're excited to offer this training again this year, since one of the things that we do here at Center on Homelessness is work with your agencies to ensure that the community is welcoming and accessible to all clients in need of services, and to ensure that we are in compliance with all of the regulations that govern these services. And so this training's content is an important part of both of these aspects. And especially with everything going on at the federal level, we want to make sure it's still really clear for all of our clients that they are welcome as they are in our programs. I guess I didn't go through all these introduction aspects, but again, I'm Kalia. I go by she, her pronouns. I'm a management analyst with Center on Homelessness within the County Human Services Agency. And I know y'all are introducing yourselves in the chat, but I'll go ahead and hand it back to Deborah.
Thanks, Kalia. And I didn't introduce myself in chat, but I did introduce myself a little bit earlier. I'm Deborah. I use she, her, or ella pronouns, and I am a directing analyst with Homebase. Good to see some of you introducing yourselves in chat. Please keep that up, because I know there's many more people here than those who have introduced themselves. And also want to go to our poll. We have a quick little poll that we want y'all to fill out, because I'd like to get an idea of what kind of settings you all interact with participants in. Um, so once I'm seeing there, I know we have about 15 participants. So once I'm seeing a high percentage of responses to that, then we'll end the poll. Thanks, y'all. Great. So, a lot of those responses coming in, and probably with looks like most people have responded. So, yeah, let's give it 1, 2, 3, 4. Yeah, I think most of the people have responded. So I think, Garen, are you able to share the poll?
Yeah, I think so.
Awesome. Oh yeah, there we go. Yeah, so y'all can see that I think that this is very helpful because we can see that a fair amount of you work in shelter settings, about half and half congregate shelter and non-congregate shelter. And then a few of you work in permanent housing settings. Don't see anyone for shared housing, but I do see we also have a fair amount that do outreach and navigation together. So about 4 of you all together that work in outreach and navigation, prevention program, and a couple in coordinated entries. So, and one other. I don't want to put you on the spot, but if you want to unmute and tell us what other is, um, I'll give a pause. Into chat. Aha. Thank you, Shani. That's perfect then. We're going because we're soon going to be introducing you, Shani. So that was the Shawnee with San Mateo Pride. So that's really helpful to see thanks for answering that poll. Very helpful to see what kind of settings y'all interact with participants in. And we're actually going to use that information a little bit later when we do our scenario breakouts. So next slide, I'm going to go over the agenda today. So these are what we're hoping to cover with y'all today is we have Ashani Dugar here today to give us some information about the San Mateo Pride Center, the resources and events they have, and then we'll jump into the training portion and we'll talk a bit about what are all the guidelines, the federal, state, and local guidelines around ensuring equal access to all, but also really looking at today's context. We've done this training many times before. I know that, maybe about half of you have participated in previous trainings with my home-based colleagues on similar topics. But really what we want to talk about is, how does it fit within today's context? Things have changed since the last time we did this training back about a year ago. And then we'll, go a little bit into how do you implement equal access and prevent families from being separated? What are the concepts around that? We'll have a little break. Then we'll go over some of the data that tells us why this is important, um, and what are some best practices for discussing gender identity, and then some time to break out and talk with one another and go through some scenarios and have some discussion. That's our agenda, what we're hoping to get to. And before we jump into everything, just want to put out some group agreements and hopefully y'all can be here with me and agree on some of these that we came up with. I know that, we're going to be discussing some potentially sensitive stuff today, so I want to make sure that this is a safe space for everyone. That we're assuming that everyone brings the desire to learn and the best your best intentions for learning. Um, and encourage you all to be active participants in your own learning. This is your time. This is I really appreciate that you all with your busy, busy lives. And I know there's a lot of work to do these days, um, always, but especially these days. Taking 2 hours out of your day is a lot. So I really encourage you to be here as an active learner. This is all for you. So as much as possible, I know it's, on Zoom and in our busy work lives, it's very easy to multitask and have distractions. I have my kitty cat on my lap. There's distractions all around us. Um, but as much as possible, try to avoid the multitasking and distractions so that you're here now and really, taking this time for your own learning. Um, Also recognizing that mistakes happen as we're practicing all this, all as we're talking about um, sexual orientation, gender identity, gender expression, um, wrapping our heads around some concepts that maybe we may or may not be familiar with. Just recognize mistakes happen, and that's okay. This is a training to acknowledge mistakes and to learn. We are here to learn, right? Um, Also, want to hear if you all have any other agreements that you'd like to make with one another. Either unmute or put them into chat. Um, Anything to help you feel like this is a safe space today. All right. Not seeing anyone unmute, but if anything comes up, please feel free to put it into chat or raise your hand. I really want to make sure that that we all feel like we're in a good safe space to learn today. Okay, now I will pass the baton to Ishani. Thank you for joining us, Ishani, with the San Mateo Pride Center, and go for it. Give us some information about the resources and events that you all have.
Thank you so much, Deborah. Thanks for inviting me. Thanks, y'all, for being here. Can I get a quick thumbs up if people can see my screen? Okay, great. It's screen sharing, but not telling me that it is. Love Zoom. So hello. As mentioned, my name is Ashani. My pronouns are they, them, or ze, them. I am the lead trainer and peer group coordinator for the San Mateo County Pride Center. And I'm here to give a quick overview of who we are, the services we offer, things like that. This is not going to take more than 5 to 7 minutes on my end. If you have questions at any point, I'm keeping an eye on the chat. Also, feel free to unmute and interrupt me. But for those that don't know, we are a Pride Center that serves the entire county. We kind of came into existence, so to speak, June 1st of 2017. So math, we turned 8 this past June. We're about 8.5 now. Some of y'all, especially those of y'all that have been in the county, in the nonprofit system for a while, may be familiar with our former parent organization, Star Vista. Unfortunately, Star Vista did close this past August, but we were extremely fortunate to be able to move to a new nonprofit and continue our programming. So if there's one thing you get out of me being here today, the most important thing for everybody to know is the San Mateo County Pride Center is still in operation. We do still exist. We are still providing programming. That's been a really big, I'm going to be honest, uphill battle for us, is just ensuring that our community still knows that we're here. And we are now under the purview of the San Francisco Public Health Foundation. So we are, again, under a nonprofit. We are settled. We're good to go. And we are operating. So very briefly, just about us, our mission at large is to create a safe, welcoming, inclusive, and affirming community climate throughout the county. The way that we do that is through a variety of programs, which I'll get into a little bit later, but they include education, counseling services, advocacy, consultations, and support. And then our vision, our hope is that we continue to create and add to an innovative, respectful, and equitable community for folks of all identities, regardless of specific labels. We are, as I mentioned, the only county-wide LGBTQ plus program center in San Mateo. However, we do have a lot of close friends and collaborators, not limited to, but very inclusive of the San Mateo County Pride Initiative, the LGBTQI plus Commission, Outlet out of Adolescent Counseling Services, Coast Pride, which is over in Half Moon Bay. We work closely with the Stanford School of Medicine, and then we have many, many more partners that we work with regularly. So we are very much a collaborative organization. So if your program or org is interested in working with us, please reach out. I'll have info to contact us towards the end. Um, as mentioned, we are here to serve the LGBTQI plus community within San Mateo County. We are also here to serve the folks who support the LGBTQI plus community, whether that's personally or professionally. So even if you yourself are not queer identified, you can still come to us for support. We're not going to turn you away because of identity. But some of the things that we do is we work to improve mental health quality of life. We hope to increase access to mental health treatment services. Obviously, a little bit more difficult these days, but we are still doing that work. We aim to support wellness and holistic support. So we do offer things like case management services. We offer education and training, and then we offer events and peer groups for the community itself specifically. In the past fiscal year, we had a fairly significant impact. There's a bunch of numbers on the page, but in general, the big kind of report is we were in contact with over 15,000 individuals throughout the county and beyond last year through our outreach programs, our training programs, our peer group, our therapy programs, and our events. So this number is an increase from the previous fiscal year. We're hoping to meet it again this year. But what this really tells us year over year with this increase is that there's very much a need for our services. Even in San Mateo County, sometimes people will ask me, "Oh, you have a Pride Center in the Bay Area. Isn't that redundant?" And the answer is often no, it is not, unfortunately. So what do we do specifically? How do we support our community in our individual programs? One of the things that is important to flag for me right now is that most of our programs are currently virtual since we don't have our own community center at this moment. However, as I showed a list of our partners previously, we do partner with other organizations and use their space for some of our events. So we do still offer in-person programming, just not specifically at our Pride Center anymore. Um, the kind of broad overview of what we do, like I mentioned, we have clinical services, um, individual, family, partner through Medi-Cal or self-pay. We also offer case management. So for folks who don't need clinical services but are looking for connection to LGBTQI plus services, probably many folks that you all are supporting, we do offer case management for individuals so we can focus in on their needs and connecting them to resources. And then we also, very importantly, do legal name and gender change support. So for folks who are looking to update their documents for more accuracy, please send them our way. Our program is a little less robust than it used to be, but we do still have the resources, and we are working with a couple other organizations to make sure we can continue to provide that. I'll go into more details for these other things as well, but we offer, as I mentioned, training and education, consultation. We put on community events, and we have a fairly robust both resource database. So we have a Google folder full of resources, and then we also are building a referral database at the same time. Currently, I will say that's located to counseling services, but we are expanding that out, and we do have housing supportive services, and we are starting to add some medical supporting services. It's a little bit of a wobbly position right now due to larger political things, but we are working on that as well. And then for our community members themselves, peer support groups, events, and then as much as we can, we offer direct resources. So gender affirming garments are something that we do offer for free for community members who are looking for them. Binders, gaffs, and including and up to just clothing. So we also have various clothings that are different styles that folks may be looking to kind of use to adjust their gender expression. More specifically, clinical services, like I mentioned, therapy and case management are really the big ones. And then we have all of this information is on our website, which will be listed at the end. But we have somebody to reach out to directly. Her name is Pearl. She's great. She's our clinical administrative coordinator, and we have a clinical services page on our website with all of our details. This is just a little bit more about the therapy. This is also all on the website. The big thing, though, that I want to highlight is we do offer income-based pricing for self-pay clients. So we know, especially within this community, access to mental health is both extremely important and also there's a lot of barriers. So we do what we can to mitigate pricing around that for folks who are looking for those services. We provide a bunch of trainings. I'm not going to spend a bunch of time on these details, but we offer trainings based on specific organization needs. So if organizations contact us for a training, we will work with you to make sure that the information we're sharing is relevant to the work that your organization does specifically. Our current body of trainings is a SOGI 101, a SOGI 201, a Trans 101, a Pronouns 101, and a Becoming Aware of Our Assumptions training, which used to be called Implicit Bias. Our trainings do cost a fee. We charge 175 an hour for virtual trainings, 200 an hour for in-person trainings. That is on a sliding scale. So if your organization is interested in a training and you cannot pay our full fee, that is totally fine. We'll work with you to figure out what your budget is. Off of trainings, we also offer consultations. So, do you not need a whole training? You just want us to look at some policies or some language or talk to your staff about a specific situation that's coming up? Contact us for that. We provide support around that as well. As mentioned, we offer peer groups. These groups are identity specific. So this is one of our services that is really focused on just the LGBTQI plus community. Our groups are based on identity typically. They meet once a month. We also have a couple of weekly youth groups. So for folks 13 to 20 or 10 to 18 and then 13 to 25, our partners at Outlet will host weekly youth groups. For anybody 18 plus, we have a book club, a gay men's group, a queer women's group, a polyamorous group, a trans group, a group for LGBTQI plus identified parents, not parents of LGBTQI plus identified youth. That is a distinction that we are careful to make. And then in January, we're going to be launching a general group as well, just for folks regardless of identity. All of our peer groups are completely free, open to the public, and we have like Zoom protocols for security. So if folks are worried about that, there are things in place. And all our peer groups can be found on our website as well. And then we offer ongoing events. I've listed some of kind of our general repeated ones, but the best way to find out what our upcoming events are is to visit our website or our Instagram. But we tend to run queeriokies, we tend to run Friday flicks, we tend to run game nights, and we also have been moving towards doing a lot of nature walks. We've been partnering with a lot of the parks programs throughout San Mateo County, and we found that the community really likes like being able to get out and hang out with each other. And so just as a quick tag directly upcoming, we do have a nature walk happening in Wonderlick Park on Saturday, December 6th. So in a couple of weeks coming up. And all of our events are also free. So the only programs that we run that cost money are our clinical services and our training services. Everything else is free for the community, and folks are welcome to join us. Most of our events will offer snacks at minimum as well. Looking for a way, want to know how to better support us, looking for a way to support us. Really, the thing that people can do most in this exact moment is tell people about us. Tell your partners, tell your coworkers, tell the clients that you work with, even if they don't need direct services, point them our way so that they can come to our events. Just kind of being out within the community and spreading the word is the number one way to support the Pride Center. If you have the ability, donations are never a bad thing, but just telling folks about us is as valuable as that, for sure. In addition, if you are working on an event facing the community, or know somebody who's putting together a community facing event that includes an outreach opportunity, get in touch with us or have them reach out to us. We are tabling, we are doing outreach, we are going to people's events to also spread the word about our services. So putting us in touch with anybody who wants to promote that, we would greatly appreciate. And that is what I have for you all. Thank you very much for the time and the attention. SanMateoPride.org is our website. I will say it's under construction this week. So at San Mateo Pride is our Instagram. That is also fully up to date. And then if you need to get in touch with us, I'll put the two emails, my email and then our general email in the chat for folks to reach out to. Thank you so much, Deborah, for putting our website in the chat. I really appreciate it. And yeah, thank you for the time to present to you all. If anybody has questions, I'll be sticking around for a little bit. I have a meeting after this, so I have to hop at about 5 to 10, but I'm happy to answer questions directly in the chat if anybody has anything. And for the sake of time, I'll hand it back to you both.
Thank you so very much, Ashani. It's so great to hear from you. Like, I've gone through the website and was so impressed with everything that's on there, but amazing to hear all of the things that San Mateo Pride Center does. So really encourage y'all to look into, if you haven't already, look into the Pride Center, share it with others, with participants in your programs in particular. And yeah, it's a great resource. It's an amazing resource. So thank you so much for sharing that with us, Ashani. So now jumping into the training part. Over the next, well, we almost have about an hour and a half. So some of this I'm actually going to go through quickly because it is review of things that we've presented in previous trainings, but I do want to touch on them. But really what we want y'all to leave here today with is kind of an understanding of where's the equal access rule, the HUD equal access rule in today's context, and what are state and local laws and policies that support equal access for all. So in addition to the equal access rule, what else is there to support equal access? Want to come away with a little bit of a shared language for understanding key terms and identities related to sexual orientation, gender identity, and gender expression. And overall, really leaving with an increased confidence in your knowledge and ability to ensure safe and respectful spaces in all of your programs. And particularly for participants who identify as LGBTQIA+. So that's what we're hoping we leave here with. So let's jump into it so that you do. First, let's just go through what is the guidance around here. So this training focuses in on the HUD Equal Access Final Rule. This is a rule that applies to all programs that are funded through the HUD Community Planning and Development Programs. And it relates to access to shelter, housing, and services, ensuring that those services are provided in accordance with an individual's gender identity, self-identified gender identity. So, ensuring that the individuals are placed in programs and services in accordance with their gender identity, regardless of their gender expression, does not have that there are no requirements for individuals to prove that what their gender identity is. It is completely self-identified. And it also calls for providers to update policies and procedures to reflect the requirements. So this is a final rule that was implemented by HUD following a very in-depth process of review and community input. All of HUD rules go through a process of getting a comment period, and a process to be finalized. So this was finalized in 2016, about 9 years ago. Next slide on the key tenets just summarizes it. It basically, so this is the clarifications. There was a rule, the initial rule came out in 2012. In 2016, the final rule clarified that gender identity is wholly self-identified. That is separate from legal gender or identity documents. It prohibits intrusive questioning or requests for documentation, and it requires policies and procedures to be updated. But where's the final rule now? Next slide. And also, so the equal access final rule, as I said before, it applies to community planning and development programs that are funded by HUD. So they're recipients and subrecipients. So that includes, I know many of you probably might receive HUD COC or Emergency Solutions Grant funding. It also applies to programs that receive HOPWA funding, Home Investment Partnership Program, Community Development Block Grant, Rural Housing Stability and Housing Trust Fund. So all of those programs, the equal access rule applies to. Now we're going to where's the equal access rule in today's context. So as I said before, the equal access rule was finalized in 2016. Today in 2025, it is still in effect. So the rule is a final rule. In order to rescind the rule, it needs to be there's a whole rulemaking process. So in order to finalize that rule, what I said before, that the HUD went through a comment period, a long process of getting comments and finalizing that rule. So in order to rescind that rule, there's a whole other process. That has not happened. So the 2016 Equal Access Rule is on the books and is still in effect. Yet, we also know that HUD Secretary Scott Turner has directed HUD staff to halt enforcement. So there may not be enforcement of the rule by HUD staff. There's also some other things I know. Hopefully, you all have heard that the NOFO was released late last week for the HUD COC funding. And there are some indications within that NOFO that the equal access rule is not mentioned at all. It's not listed in the list of policies. There's a list of policies that applicants need to comply with. And that list of policies also adds in executive orders that Trump has released that may indicate that that programs may be penalized for implementing equal access. It is not specific within the NOFO, but there is an indication that it's definitely an indication that the federal government is very much moving away from enforcing and looking to rescind the equal access rule. So that, I think that's information for all of us to be aware of. Going back, actually, so within that list, though, there is still the Federal Fair Housing Act. The Federal Fair Housing Act is law, and this is a law that provides protections against housing discrimination on the basis of a variety of protected classes, and that the Fair Housing Act does include protection against discrimination based on sex, which has been defined by the Supreme Court to include sexual orientation and gender identities. So the Fair Housing Act is a law that still continues to have protection against housing discrimination. Next slide. There are also other protections, state protections and local protections beyond the equal access rule that are legally binding and prohibit discrimination in housing and housing related services. So many states and localities, and California and San Mateo, where we are now, have similar statutes to the FHA that exist and that continue to provide equal access protections. So primarily the California Fair Employment and Housing Act, FEHA, provides even more protection than the FHA based on it. So FEHA actually very specifically provides protection based on sexual orientation, gender identity, familial status, and many other protected classes. And I also want to point out that the San Mateo County COC policies and standards do include equal access and non-discrimination requirements. And San Mateo County also has a transgender policy that applies to county employees. I know many of you are not county employees, but just want to call that out that, state, according to the state and locally, there are many protections beyond the equal access rule to ensure protection against discrimination for people who identify as LGBTQ plus, as well as many other protected classes. Next slide. Yeah, so this just goes through some of the other protections that the Fair Housing Act provides, prohibits housing discrimination based on all of these protected classes that are shown on the slide, including sex. And it prohibits discrimination in renting or buying a home, obtaining a mortgage, seeking housing assistance, which I am emphasizing because that is what many of us assist participants with, and engaging in other housing related activities. And it does apply to all recipients of federal financial assistance. So if your program receives federal financial assistance, then the FHA applies to you, but it also applies to all housing. So if you're providing housing or housing related activities, housing assistance, the FHA does apply to those services, regardless of ownership. Next slide. California, as I said before, California also has very strong protections against harassment and discrimination in housing, as well as in employment and business establishments, based on sexual orientation, gender identity, or gender expression, as well as many other protected classes. So I already brought up FEHA, the Fair Employment and Housing Act, which protects from both harassment and discrimination. And it also bars retaliation against any person who files a complaint. So it kind of has that whistleblower, so to say, protection in it. And there's also the Ralph Civil Rights Act, which prohibits violence or intimidation based on a person's actual or perceived characteristics, which very much applies, and the Unruh Civil Rights Act, which prohibits discrimination by business establishments. So that does include housing and public accommodations, and it specifically defines sex as including gender identity and gender expression. So all of this is to say, really, just to say that equal access is protected by federal and state laws beyond the rule the equal access rule, which has specific requirements for programs that receive funding from HUD. Slide. One thing you also probably, especially if you're entering information into HMIS, have heard is that the HMIS data standards, they update data standards every other year, and those data standards provide guidance around what does the federal government require is collected in HMIS. So this is a screenshot from an email that some of you may have received if you're entering into HMIS. Those 2026 data standards became effective October 1st, so this is already happening. There is a new field on the enrollment screen for sex, and that enrollment screen no longer has gender and sexual orientation on it. And from what I understand, that field is not being added to core service agency programs. But then there's also those, so the gender and sexual orientation data is still um, being gathered, collected on the client profile screen, and that is for local use. So we will still be able to, on a local level, gather that data on gender and sexual orientation. So the next slide just kind of shows what are the definitions from the HMIS data standards manual of the different options that you can enter on that enrollment screen. So the options are female, male, but there are also other options. I just am raising it up that the other options are that the client doesn't know. And that is for when a person states that they do not know their sex from among the other responses, um, or prefers not to answer. And that is if the person chooses not to identify their sex from the available responses. So, as we're talking about, self-identification and encouraging that, I just want to raise that up that within that new screen, there are options beyond female and male when you're working with clients around that. Okay, so why is this all important? Um, let's just jump right in. It is ensuring equal access to housing, to shelter, to services. Those are all things, especially if you believe that housing is a human right. Um, they're important to ensure that everyone has access to those. So, today we're emphasizing equal access regardless of sexual orientation, gender identity, and expression, because we know that people who identify as LGBTQIA plus experience homelessness at extremely disparate rates, and often are misunderstood and denied equal treatment, and face discrimination in the services. So the U.S. Trans Survey is one source of data and information that helps to inform this, that tells us that, yeah, based on that, there is data to verify that people who identify as transgender or non-binary are experiencing homelessness, or experiencing many other unequal treatment at disparate rates. So this was a survey that was conducted in 2022. It's the largest national survey that got information directly from people who identify as transgender or non-binary. I'm going to put the link into chat, and I just want to raise up that I'll put links as I'm talking into chat, primarily for you all to copy for yourselves if you want to look at it before we get around to sending out a follow-up with all of the links. Not necessarily for you to dig into and look at here, because I'm giving you some overviews. But the survey, really dug into a lot of different questions, really, focusing on health, mental health, identity, family life, employment, housing stability, economics, identity documents, etc. So, next slide, some of the key findings of that survey. Particularly in relation to the work that we all do in the community. Some of the key findings that we've pulled out are around health, experiencing homelessness, and equal treatment. So I think it's important to note that almost 50% of those who reported that they saw a healthcare provider in the last 12 months reported that they had negative experiences, at least one negative experience with that. And that could be being refused healthcare, being misgendered, having a provider that uses harsh or abusive language when treating them, having a provider that's physically rough or abusive. So healthcare was one very big thing that came out in the trans survey. but especially, particularly in relation to our work, um, almost a third had experienced homelessness. Um, 9% reported they were denied equal treatment or service because of their gender identity or expression. And I think really important is that your very high numbers of LGBTQ plus youth um, reported that they were experiencing homelessness. So that is um, a key population that I know we see a lot in the Bay Area as experiencing homelessness. Next slide. So the trans survey did, dug into poverty, more than one third experiencing poverty, high unemployment rates amongst the respondents. Many of the respondents said that they had lost a job or been fired due to their identity or expression. Um, and also, I think really important for our work is noting that almost half who had an identity document, so birth certificate, passport, more than half of them said that those documents did not list the name that they wanted. So I think that's something to really pay attention to, especially, and we'll talk about it a little bit later, around identity documents, right? Some had the name they wanted, about 20%, only about 20% had the name that they wanted on some of their IDs. Next slide. So also the point in time count, looking at the national point in time counts, we see disparities in gender expansive people experiencing homelessness. So NAEH did this look back on gender expansive people who are experiencing unsheltered homelessness. And you can see here in this graph from 2018 to 2024, there's a very large increase in the number of gender expansive people experiencing unsheltered homelessness. And so, these numbers, between 2018 and 2024, we know that we also got a lot better and continue, hopefully, to improve how we're gathering data and information about people who identify as gender expansive. So some of that number increase might be related to data, but it's also very clear here that more and more people who are identify as gender expansive are unfortunately experiencing unsheltered homelessness. So, and this is just putting that report, the link to that report in the chat there for y'all if you want to check that out. So overall, really, what does this tell us? On the next slide. Oh, sorry. Yeah, the next slide also is so in addition to all this, the national data that we have, all that information, we have local information, local findings. Last year, and I know that San Mateo HSA, the Center on Homelessness, presented a little bit during our training last November on their the study that they completed in 2024. So they conducted qualitative interviews, possibly with many of you, with service providers and system partners, to really get an idea of what are the needs around serving LGBTQ plus participants in programs. So in a nutshell, these are the areas that the findings in that report had, that data collection standards and practices, they vary. One of the findings is that they do vary based on across programs. So it varies based on staff's level of comfort in asking questions and collecting information, and and in implementing the data practices. Um, Medical and behavioral health care agencies that serve homeless populations, that it was found that there are a variety of care and resources for unsheltered LGBTQ plus community. There are a variety of resources out there, although some mental health resources um, are out there. The targeted services for specific populations are not as robust as needed. That was one of the findings. So it would help to have better support for, particularly specifically for the LGBTQ plus community. Um, Also, one of the findings of that report was that individuals seeking shelter, especially those who identify as transgender and non-binary, are they often decline congregate shelter options, and that's often due to fear, past experiences, bullying, harassment, etc. So that was one of the findings. And also that there's a need for more specialized housing solutions for LGBTQ plus individuals. Um, and really, overall, one of the key findings of that report, um, or of yeah, that report was really that key is to approach clients with respect and showing openness towards understanding towards their self-identified identity, understanding their identity, and being open to really develop rapport with people, make them feel welcome and accepting services. Uh, so yeah, all of that together kind of give us that picture, right? Of why is this important? Why is it important that as providers of shelter and housing related services, why is it important to pay attention to equal access and to ensure that our programs provide equal access? Um, so now I just, that I've gone through some of these, the laws and the policies and protections and the data. I'd really like to hear from you all, or at least give y'all a moment to think about these questions before we move into the next part of our training. We're going to have a little break, but I want you to think before we move into this next part of the training to set up for it. What are the expectations that are placed on all of us because of our gender roles? What are the expectations that have been placed on you? How might a person who presents themselves as falling outside of our societal gender norms, how might that person be treated if they fall outside of those gender norms? And also what experiences might result from the expectations that we have or treatment of others based on their gender expression. So, feel free if anyone feels like talking, give you a pause to unmute and talk. Also, just think about these. I really want y'all to ponder before we move into the next phase. How does gender show up in our lives? Ideas in chat. I can share just to get your thoughts going. Yeah, I mean, I know that expectations are throughout my life were placed on me. Guess you'd the traditional language, or what I always heard growing up, is you're a tomboy. Why don't you wear dresses? I wanted to go out and play soccer and football with the guys, but the expectation was, oh, don't you want to play with this part? I would get Barbies, um, for my presence instead of the soccer ball that I wanted. Yeah, so those are, expectations based on, my um, gender growing up. And yeah, so just thinking through, what were expectations that were placed on you? Oftentimes it's easier to think of ourselves and our own identities, right? Um, and, how are you treated? If that, those, if your expression was different from the expectations of others, um, or if not, right? There's also that, belonging that we often strive for in our lives, and sometimes we do comply with how others expect us to express ourselves. Okay. Well, I'm going to move on because it's obvious that I hope y'all are pondering and thinking. But I can feel it that, yeah, this room, y'all are maybe a little bit more introverted. Thanks, Karen. You're surely pondering.
I think I just saw Sandra. Did you come off
Yeah,
mute?
me
Yeah,
too.
go ahead.
Can you hear me? Okay. I think I thought of something. I think growing up, I've been very have a very bold personality, and I was very confident, and oftentimes I'd like dominate conversations or start conversations or sort of take the lead in that. And I heard a lot that, because I'm a woman, I need to be a little bit more polite, more agreeable, and very soft spoken. And my voice carries. And, a lot, I heard that growing up from my aunties and, women in my life were ones who told me like, hey, you're a woman, you need to be more of this and less of that. And so I think that's one thing that I can think of. What expectations are placed upon us because of our gender roles. And I think of that when I was growing up as a teenager and even in my early 20s, late teenage years. So that's it.
Thanks so much for sharing, Sandra. And yeah, I think that's helps us to think about that point of, there are a lot of cultural and societal expectations of us because of the way our because of our gender. Um, and then moving beyond that, thinking about, how has that affected you and how you move through life. And then also moving beyond that and thinking about the participants that we're working with in the shelter and housing programs that we're working with. How does it affect those who all of our participants in how they express their gender and the expectations that are put on them by society, but also, by other participants, by, property owners, all of those with whom, we're interacting and working with. Well, due to time, let's move on because I want y'all to be able to take a break, and then I do want to make sure that we have time. But before we take the break, I'm going to leave that. Let's leave this up on the screen during the break. We're going to have a 5-minute break. But if you all don't have your pronouns in your Zoom name and you would like to share them, this is completely optional. But if you would like to share them, kind of like how I have in my Zoom name, this has the instructions. So it used to be something that you could do right away within any Zoom meeting. Zoom has changed that, so you do have to go into your Zoom account and go to that profile page in your Zoom account. It's kind of the top left-hand sidebar. You go to the edit screen, And then on the edit screen, you can put in your preferred pronouns and you can indicate how you'd like to share them. So you can see here for me, I indicate I always share in meetings and webinars, but you can also say, ask me every time I join. You can also say, don't share, but then if they're in there and you say, don't share, when you're in a meeting and you decide, oh, I really want to share. Yeah, thanks, Sandra. I see that you went ahead and did that because you're up on my screen. um, but yeah, so you can go in a meeting and click on that more button down on your toolbar and indicate if you want to share or unshare your pronouns. So that's little tool you can use if you'd like to. And let's go into a quick 5-minute break. Let y'all stretch a little bit, go get something to drink or eat if you need to. And we will be back at 2:08 on according to my time. I'm actually going to turn on the timer. See ya. Next phase. Thanks. As we jump into the next part of our training, which is really digging into how do we implement this? How do we ensure that that we provide equal access to our programs, to our services, in all of the work that we're doing. So first, I want to on the next slide, just a quick review. Give me a thumbs up through the reactions if you feel that you are familiar with the term SOGI. Use the, I can't see everyone, so use the reactions or put it into chat. And as X, I'm assuming means not familiar. Okay, I'm not seeing many thumbs up and I'm seeing one not familiar. So I'm going to quickly go through what does this mean? What does SOGI mean? So awesome. Thanks. I appreciate the feedback. So SOGI is a acronym that is used to refer to sexual orientation, gender identity, and gender expression. So these are all characteristics that all of us as human beings have our own SOGI. So, some of you may have seen, there's other visuals that others have used. There's a gender unicorn visual I've seen a lot. This visual I took from the California LGBTQ Health and Human Services Network. And I'm going to also put that link if y'all want to get more info on that. But this is their fact sheet. I just want to give them the acknowledgement for that. And just quickly going through what does SOGI mean? It's one of SOGI embraces our identity, our gender identity, how we express our gender, our sexual orientation, and our sexual behavior. It's an important part of everyone's identity, and as we started to think about previously, it impacts how people experience themselves, how they interact with others, how others interact with them, as well as what systemic barriers they might face, right? So everyone has their own unique and multi-layered gender identity, gender expression, and sexual orientation. So the next slide goes through some definitions of what all of this means. So starting with sex, this is generally what is assigned to you at birth. It's based on physiological traits. So this is, physical. Oftentimes it's based on external genitalia, but also many other things are included in determining the sex at birth. Generally, it's only female, male, possibly intersex. Um, and that is usually, it's a determination that is usually made immediately after birth. So at the very beginning of your life. Gender, on the other hand, is based on sociocultural systems and beliefs. So it's pretty much that spectrum of masculine and feminine characteristics that is it's distinct from a designation that's made based on our physical anatomy. Um, so gender identity is it's one's internal and personal sense of what their gender is. It's your own personal sense. Just want to emphasize that. Um, and your sense of gender actually starts fairly early. Children, it's been found that most children start to develop that sense of gender around 2.5 to 3 years of age. Um, And on that note, I really want to recommend KQED. Their California Report series has been doing this series the last few weeks. I think they're still doing it on, it's called Love You for You. And I'm going to post that in chat as well for you to bookmark. I highly recommend listening to it. It's youth being interviewed and talking to their parents, to their grandparents, and discussing their gender identity. And so, gender expression then that's the way that we express our gender. It's how do you communicate to others what your gender identity is? So that can be through clothes, through behaviors, mannerisms, etc. And also, each of these terms are distinct. So gender expression might not necessarily connect to gender identity. How you express yourself may not show to the world how you actually identify your gender. So important to consider that all of these are distinct terms. Gender expression also can be very fluid. It can change over time and in different places. Sexual orientation, then, sexual orientation describes our attraction. So it describes our emotional, romantic, and physical feelings of attraction. Usually those feelings develop over time, and it's distinct from sexual behavior. So once again, these are two distinct terms. Sexual orientation is our attraction. Sexual behavior is how we express that out in the world. And sometimes they're in alignment and sometimes they are not. And both are completely valid. And also with sexual orientation, research indicates that we generally start to develop those involuntary patterns of attraction during middle childhood, like around 6 to 12 years old. Next slide. So all this is to encourage us to start thinking with full spectrum thinking, right? So our eyes can typically see these colors, very distinct individual colors, but we know that there are infinite unique shades in between. So Garen, can you click for me? Yeah. So this is the full spectrum. And so in discussing this, we encourage everyone to really think beyond those strict binaries, the strict constructs of, of definitions, to have a more expansive understanding, because every individual is a unique individual with a full spectrum of experiences and identities. And often those strict constructs, they result in regulating policing, invalidating people. And we know that there's a lot more to every human being. So encourage you to employ full spectrum thinking, because when we're not using full spectrum thinking, we're often ignoring how multifaceted and amazing and unique each one of us is. Next is intersectionality. So we also, all of us have an intersection of various identities and experiences. So, our age, our sexual orientation, our race, our sex, our class, our gender identity, gender expression, all of these are intersecting, right? We are not one identity. Each one of us is a, as I said, a unique amalgam of multiple identities. Um, so yeah, think about, what are your intersecting identities? And what are others' intersecting identities? So as we move into looking at, implementing equal access, a lot of that is based on really recognizing that full spectrum of our unique intersectional identities. Next slide. So how does it, as we're thinking about this, how can our language make an impact? And I think, in thinking about how the language that we use, how we present to others, it makes an impact. And terms can often convey bias, right? So when we are communicating with others, thinking about, to pay attention to the fact that there are so many intersecting identities and the full spectrum of colors and individuals out there. When we're speaking with others, consider, how can we use either more gender neutral or more inclusive language? So, rather than saying, hello, ladies and gentlemen. Um, Hello, all. Hey, folks. How's everyone doing? Hello, everyone. Um, in questions, if you're asking people, instead of asking you, do you have a boyfriend? Do you have a partner? Do you have a significant other? So thinking about how our language and how we're asking questions can move beyond, how that can convey bias and how we can move into more neutral and inclusive language. Also asking for and using pronouns. So, in asking, avoiding assumptions when you're interacting with others, and asking in a gentle and respectful way. How do you identify? Or do you have, what gender pronouns do you prefer to use? How may I respect your preference, and how would you prefer that I refer to you? So, talking to people one-on-one, oftentimes if you're, one-on-one talking to people, the gender pronouns won't come up immediately. So it's also important to build a rapport with people before asking, before you asking for gender pronouns, so that it's appropriate. You're not just straight off, oh, hi, Garen, how are you? What are your gender pronouns? It's, build that rapport first. But once you build that rapport in a gentle and respectful way, it is helpful to, if you don't know, if somebody doesn't introduce themselves with their pronouns, and you don't know, rather than making assumptions, asking. And also always remembering in our language that self-definition is key. So, ask people about, how do you prefer that I refer to you? Avoid those assumptions, and as I said before, be gentle and respectful. Next slide. So getting down to how do we implement equal access in our programs? So when we're effectively implementing equal access, meaning that we are ensuring that everyone has access to safe shelter and housing programs. We're serving people in alignment with, once again, self-identified gender identity, and ensuring that people have access to dignified and respectful services. So safe, dignified, respectful, self-identified. those are really some of the key words when we look at in implementing equal access in your programs. So let's dig into it. What does this mean? Next. So in implementing around self-identified gender, the equal access rule as well as best practice really clearly identifies that there's a difference between actual and perceived gender identity, right? So gender identity is the gender with which somebody identifies, right? Regardless of the person's perceived gender identity, what others think they are, it's what they know they are. And regardless of of sex assigned at birth. Perceived gender identity is there's the perceptions of others based on appearance, behavior, documents. So the equal access rule states that individuals must not be subject to intrusive questioning or asked to provide kind of proof, anatomical information, or proof or evidence of their gender identity. The key really is that self-identification. And to really make it clear that gender identity is defined by the individual. So this slide kind of shows an example of what is that difference between actual gender identity and perceived gender identity. It is, what it really comes down to is how does the person identify themselves rather than how do they seem to others. And once again, it can be different than what's listed on documents, on birth certificates, etc. It is the gender with which they identify themselves. So the equal access rule requires that, and best practice beyond the equal access rule. We really, the key is to always honor and act in alignment with what someone's actual gender identity is, rather than the perception. Then in implementation in our policies and procedures, so program policies and procedures they're important because, with what did program policies and procedures do? They provide written guidelines about what is to be implemented or how things are implemented, right? They are the foundation for implementation. So it's really important that our policies and procedures support ensuring equal access to programs for all individuals and for their families, making it clear that housing and services are provided in accordance with the participants' self-identified gender identity, do not require proof of documentation. Policies should also allow for eligibility regardless of sexual orientation, gender identity, or marital status. So really the goal is to be able to accommodate all participants, right? Recognize sometimes it can be tricky, especially if, sometimes there, others express discomfort with one's expressed identity. Conflict sometimes comes up, and we'll go into that in just a bit. But just like we shouldn't tolerate discrimination due to race, it's also important not to tolerate it due to gender identity or expression. So the policies support this. And really other things that policies can support, in addition to accommodations, they can support. How do you deal with those conflicts? Can the policies can support having restorative conversations when conflicts come up, etc. Next slide. Also, so in facilities with shared sleeping or bathing areas. So I saw in that poll earlier that definitely some of you work in congregate settings. And I'm sure those that that don't have congregate sleeping settings, there's also oftentimes congregate bathing areas or restrooms, right? And sometimes it can be tricky because as a provider, equal access means you place people um, based on their gender identity, but that you're also serving everyone equally. Um, so important to not make sure that you're taking measures that don't impact how an individual accesses your programs, how they experience your program. Um, so you making placements based on someone's self-identified gender identity, but also you need to be able to address concerns and to figure out if you can, how to address concerns, whether those concerns are coming from an individual who has a gender identity that is different than their gender expression, or from another participant who has a concern about that participant. Um, so some examples that come up, for example, if a trans man comes to you and says that he feels uncomfortable showering because you have a congregate bathroom and that bathroom doesn't have stalls or curtains around the showers. The best response in that situation is to look at, well, what can you do to address the space, to make that space more safe? What can the program do to ensure greater privacy? Can you install stalls? Can you put in shower curtains, right? That's the first step, is to look at what can you do to ensure greater privacy, rather than asking that participant to shower at a different time, for instance, than anyone else. Another example is, if you have multi-stall bathrooms and you also have single-stall bathrooms and a participant is uncomfortable. I think, first and foremost, it's asking what I said before, asking questions, asking what would make you feel comfortable. And if that, having that conversation with them. So, then exploring, okay, we have a single stall bathroom. Would that be more comfortable for you? We can provide you access to that bathroom. Or is there a way, exploring, are there different times when the bathroom can be specifically used for you or for various genders? But generally, it's talking to participants, asking them what would make them comfortable and working with them, and then also looking at how can your program make changes? How can you change the space to make it a more comfortable space? Um, Another key there is just ensuring that you're always when you do make those decisions and have those conversations, put it into writing so that all of the staff are aware of the situation, aware of any accommodation that are made, and everybody's pretty much on the same page, right? Another thing in equal access is the equal access rule defines a family specifically as a group of people that present together for assistance and identify themselves as a family. So that is regardless of age or relationship or other factors. So really what this means is that any group of people presenting as a family must be served together as a household and not involuntarily separated. Next slide. Yeah, so this slide has some examples of scenarios for families that the equal access rule provides protections for, and that are best practices. So not separating teenage boys from their families, not separating out or denying assistance to adult men that present as part of the family, regardless of their relationship to the family, limiting assistance to households with children based on the space or the program structure. So that's something that a shelter or housing program may do that because you don't have the space to accommodate children. But if you do have the space, and your program can accommodate families with children, you can't limit that assistance to only women with children, for instance. Um, Also serving any two adults who present together as a family, regardless of whether they have proof of marriage or any other type of relationship. And also another thing, especially I know I used to serve families, and you're often placing families in rooms based on family size. But a housing program that is serving families can't reduce the size of the family because the child is in foster care or is not currently with the family, but is still a family member. So, for instance, if the family is there's a child in foster care, the family is in the process of reunification or working with child support services, you must consider that child as part of the family. So there is room for that child to join the family, whether they're visiting, they're reunified, etc. Um, so that's some of the requirements regarding just ensuring that families, regardless of how they identify as a family, are kept together. So, with all this guidance, how do we actually ensure that we provide safe and respectful services for all? Um, it does vary on the setting that you're interacting in. I'm really going to go through these next slides really quickly, um, but want to go through it so to give you a little bit of a basis to go into your breakout rooms to start talking about some scenarios and what comes up in your programs. So when you're doing outreach, engagement, and assessment, it's providing equal access is accept the name and gender given by the individual, use the pronouns that they indicate, and if ID is required, you still use their current gender identity, the identity indicated by the individual, not on the ID. So that's, once again, that's self-identified gender identity. Next slide. When you're doing enrollment, ensuring that you're providing a confidential area to discuss with participants, to describe your services and to discuss with them what information you need. Not asking about their sex assigned at birth during that intake process, although I did put an asterisk there because I do recognize that with the new 2026 HMIS data standards, there is that sex field on the enrollment process. So you do need to ask about sex. But as I said before, there are multiple choices there beyond male and female, and doesn't necessarily need to be sex assigned at birth. And if you're working with a program that does provide services based on gender, for instance, it's a shelter that has that's specifically for males, specifically for females, or has male or female areas, accept what the participant identifies as. So if a participant is non-binary, ask explain these are the housing options that we have. What would be most comfortable for you? How can we best accommodate you? So, once again, going back to that self-identified and the autonomy of the individual in the process. In assigning units and beds, quickly resolving conflicts when conflicts come up with other participants, really, having those discussions with participants. I said before, and having restorative conversations with participants to resolve conflicts, to talk through things, modeling that appropriate respectfulness, coaching participants that have that express disrespect, coaching with them, talking to them about it, pulling them aside, doing it, in private, but having those conversations and, allowing it to, conflict does happen. We know that. And conflict comes up often around gender expression, gender identity, sexual orientation, right? So providing a confidential space to discuss issues, to talk about it, and to figure out how can we work through this conflict? How can we accommodate and provide equal access for all, right? For all of the participants involved. Next slide. And in our ongoing services. So really, recognizing participants' rights to access all of the services that they're eligible for, correcting misperceptions around that that gender expression might create a safety risk because somebody is expressing in this way, and ensuring that participants understand that bullying is not tolerated. So really, not tolerating it, and also offering those, once again, restorative conversations, really to be able to work together with participants to resolve conflicts. Next. So yeah, this is all about changing the culture. And our key takeaways here are that the Equal Access Rule, California, including California law and local standards, require accommodation in accordance with an individual's self-identified gender identity, self-determined, and that this is the baseline requirement. Our goal as providers, really, the key takeaway is to foster safe, affirming, and welcoming environments for all participants. So, with that being said, we have a little bit, teensy bit more than 20 minutes. I want to go into our small group scenarios. So I'm going to put a link to scenarios in chat, and we're going to have, I think we're going to have 4 rooms that people can choose from based on the setting that you tend to work in. We're going to have 15 minutes in those rooms to have discussions with one another. So I know y'all have been quiet, but now it's your time to talk with one another and discuss these scenarios. Just put them into chat. So that will take you to a Google document that has a whole bunch of different scenarios. Most of them say on them the different type of settings, and choose a few that are most applicable to you or are most interest to you. Talk through them with your group. How would you handle that situation? What would you do? Take notes, because hopefully we'll have a few minutes after your 15 minutes. We should have about 5 minutes to come back and talk about our key takeaways.
Deborah, just one thought.
Yeah.
It's a pretty small group. It seems like it looks like a couple
Oh,
people have dropped off. I think we're down to if we subtract you and me and the HSA folks, there are like
yeah,
11
11.
folks left. So maybe we do 2 groups, or we could also have one conversation here, or we could do 2 groups. Maybe like maybe shelter and permanent housing as like the 2 groups.
Yeah, or I would say maybe congregate, non-congregate.
Cool. Yeah. So like congregate and non-congregate programs.
Yeah, although I know some of you, there might be some who do outreach or just housing navigation, case management, so you can decide which you want to discuss. Does that make sense?
Okay. The rooms should be open. There's one for congregate programs, one for non-congregate programs. So yeah, as Deborah was saying, if you don't fit into either of those categories. If there's one that you work with more often or one that you have more sort of perspective on, feel free to go to that group. And you should be able to just hit the join button.
And I also just put a couple another link to some different scenarios if those ones don't pique your interest. There. Also, feel free to let us know if you have any question about which group to go into, or if you prefer to stay here and ask us questions, you can do that as well.